do I have to take this medication? Why are you making me ambulate while I have this Band-Aid on? Can't you see it?
Do you need another nursing theory? I'll tell you all about the theory of unpleasant symptoms. This theory tells us that patients perceive illnesses and challenging treatments as clusters of unpleasant symptoms that both individually and jointly impact their experience of illness, their emotional distress, and their functional abilities. In simpler terms, it's not just the actual pain, it's the combination of the pain and anticipation of unpleasantness of treatment and recovery. The unpleasant experience is the pain and everything else that comes with being a post-op patient. 3 factors affect how patients experience unpleasant symptoms. Number 1, physiologic factors such as your health or pathologic problems such as infection. Number 2, psychologic factors like your mental state or how you feel about being sick. And finally, number 3, situational factors such as your economic status or social support system. These factors all affect the duration, intensity, and quality of your symptoms along with the level of distress you experience. In turn, this affects your performance on both physical and mental levels.
Well, that's great that you know all of that, but how does that relate to my situation? How does that make you a better nurse for me?
Oh, girl, that hurt me. Well, interesting you say that. I recently read an article on children's post-op tonsillectomy and adenoidectomy. The purpose of this article is to determine post-op outcomes in PEDS patients. Some outcomes measured were pain medication use, fluid intake, anamnesis at home. They looked at several trials to discover the optimum way to administer the analgesics so that the child would have less pain. What they found was that regardless of the types of experiments they ran, the children reported the same amount of pain. This was due to something that most researchers did not take into account: the caregivers of the child. The caregivers tended to not give the child the recommended dose of the analgesics due to a variety of factors. Some caregivers believed that it was similar to an opioid and that their child would become addicted. Others believed that it did not help, or that the throat pain was not a severe enough reason to give pain medications. Ultimately, the best results in pain management came from educating the caretakers on why giving the medication at the appropriate time and the appropriate dose was important. It's important to remember that family pain education is a vehicle that can enhance both the child's and parents' understanding of his or her pain experience. In short, to answer your question, we're not doing this to hurt you. We're doing this because we know what's best for you. Nurse Nessie, over and out!
You're so helpful.